everybody, and a very good morning to all of you, and welcome back to the show. Yes, you're watching Good Morning Sri Lanka and you are tuned into MTV Sports with me, Wassam Ismail. And of course, I come bearing good news today because MTV Sports has decided to give our viewers 10 invites to Lone Ranger, 10 invites each for the movie, and you can actually decide when you want to watch it until the 7th of August, any weekend until the 7th of August. So now if you want to be eligible to win tickets, all you got to do is you need to SMS MTV space LR, that's MTV space LR to 7788. That's MTV space LR to 7788. So don't wait anymore, pick up your phone, send that SMS, and you may be a lucky winner to win those tickets. And that's not all. It is the 24th, it is a Wednesday morning, which means there are more things that you need to be excited about. Well, I'm sure you're counting the days until the 30th of this month, because it is between now and the 30th that you usually get your salary at the end of the month, and that is indeed something that you need to look forward to. But when it comes to other things, of course, GMSL is something to look forward to as well, because you know why? When it comes to GMSL, we talk about different topics every morning, from art to medicine to just different opinions and a lot of educational stuff. We talk about a lot of stuff, and today we've got an interesting topic lined up, a topic that a lot of people have heard of but may not be necessarily familiar with. So we are going to explore that. Now on that same note, I'm sure when you go out of your home and you order a cup of plain tea, you sometimes get a plain tea which there's a lot of sugar in, and sometimes you have it, you may enjoy it, or you may make a joke, which we sometimes, we call those over-sweetened plain teas, we call them diabetic teas, and there is a reason for that, because sometimes excess sugar can cause diseases such as diabetes, and that is the topic that we are going to touch on today. So to discuss the topic, we have some really good doctors on board. As usual, we have interesting guests in our show, and today is just the same. But before we do introduce the guests to you, we want you to have a look at this video. So check it out.
You are not alone.
Of course they're not alone. We're right here.
No, I mean, they're not alone because they have diabetes. This affects millions of people every year.
Millions? Is there a cure?
Unfortunately, there is no cure. But there is treatment. And after we tell you what is happening in your body, we'll show you how to take care of yourself.
Look out, diabetes! Here we come!
The body is made of trillions of cells. That's a million that need energy to function.
Millions of millions? That's a lot. How about 7?
The food you eat is turned into sugar, which is called glucose, and glucose travels to all of your cells through the bloodstream. Inside your body is an organ called the pancreas. The pancreas makes something called insulin, which helps all those cells in your body use the glucose.
Your cells need the glucose to grow and get the power they need.
If you have diabetes, your body has trouble controlling the level of glucose in your blood. Either your pancreas isn't making enough insulin, or your cells aren't reacting to the insulin the way they should, so there's too much glucose running around in your blood.
And that's a bad thing?
Yes. Having too much or too little glucose in your blood can damage your heart, blood vessels, kidneys, brain, and nerves, and cause eyesight that gets worse and worse over many years.
And that's not good. How do we know if we have this?
Some symptoms are too much thirst or hunger, peeing too often, weight loss, tiredness, changes in vision, slow healing cuts, and itching of your skin that goes on and on.
That's a lot of stuff.
That's why it's very important for people with diabetes to take care of themselves. In some cases, people with diabetes need to take daily insulin shots. Sometimes you can control this disease through diet and exercise, and taking medication by mouth. Your doctor can help you with a diet and medication plan so that your blood sugar is regulated.
I know some healthy foods: fruit, vegetables, whole grains, fish, nuts, beans.
And you need to exercise too. Getting good exercise really helps your body control your glucose levels.
You can run, swim, skip, hop, bicycle, jump rope, play games,
Just keep your body moving.
dance.
But even when you're as active as Daniel, you still need to check your blood sugar level regularly. Your doctor will show you how, and in no time, you'll be able to do it yourself.
There you go. That was a little video on diabetes in a nutshell. And of course, like I said, diabetes is a topic that a lot of people have heard of but may not necessarily be familiar with. I mean, we've heard of diabetics enough for more time, but we really don't know what it's about. So today, our mission is to educate you about what diabetes really is, and what kinds of treatment you can get, and how to basically avoid it, or etc. So we have, like I said, we have some really interesting doctors today in the studio, and I'm going to introduce you to them. And first doctor we have is Dr. Shama Subatunga, who is the resident physician at Jayawardhanapura Hospital, and of course she has a special interest in diabetes. And of course our next doctor is Dr. Rasantha Pumullage, and also we have Dr. Anuranga Appa, who are medical registrars conducting the diabetes clinic at the Sri Jayawardhanapura Hospital. So good morning to all of you doctors. Thank you very much for being with us on the show. And of course, I know we just witnessed a video. It did tell us a little bit about diabetes in a nutshell, but I want to know your opinion on what diabetes really is. So if you can just tell us.
Yeah, diabetes is an illness caused by persistently elevated glucose levels in the human body. Now, in healthy humans, glucose levels are maintained at a very narrow range. That is the best and optimal value to function the cells in a maximum capacity. If particular individual's sugar goes out of this range, the cellular malfunction occurs, and this causes lot of tissue damage and organ damage, and maybe severe damage which might be permanent. I
see. So yeah, very good. Diabetes in a nutshell. So if I'm to say, I mean, you did mention words like glucose and stuff, and I'm no medical student, but the way things I've heard, I've been told that, you know, diabetes is due to excess sugar. So would you agree?
Yeah, yes. Normally when a healthy person takes a diet, the carbohydrate content in the diet turns into a glucose in the digestive system, and then it absorbs to the bloodstream as glucose.
I see. So doctor, the other thing I want to ask you was, like, when I was introducing the topic on the show, I did touch a little bit about you know, you walk into a shop, you order a cup of plain tea, and sometimes it's just filled with sugar. And here in Sri Lanka, wherever you go, people tend to add a lot of sugar in their food, and as a result, I'm guessing that we have a high rate of diabetes in the country. Would you care to elaborate a little bit on that? How bad is diabetes as a problem in Sri Lanka? How big is it as a problem in Sri Lanka?
I don't think we have very specifically assessed data for Sri Lanka. But now, not only in Sri Lanka, among the Asian countries, the tendency to develop diabetes is higher than the rest of the world. So, I don't know, madam.
Roughly about 15 to 20% of the population is affected by diabetes. Not only in Sri Lanka, it is the same if we take the world figures also.
I see.
They say now, especially the younger age group, now there's a tendency to develop diabetes at a young age. Now, in the past, it was a disease of the old age. Now it's not like that.
Actually, the type 2 diabetes, it is begins after 35 years, but recently we see even before 30 years, people are getting diabetes, maybe due to bad food habits, maybe lack of exercise, the lifestyle.
So and we really named it as MODI, that is maturity onset diabetes in young people.
I see. So you'd say, as a country, as a population ratio, we find diabetes is a big problem in this country. Definitely. And you said there was like about 15 to 20% of people, and that 15 or 20% would be patients who are detected, am I correct?
Yes, and actually we might be seeing just the tip of the iceberg, and there may be a lot of undetected patients, asymptomatic patients living in the population without knowing that they are having diabetes.
I see. Okay, getting back to diabetes now, we've heard this term pre-diabetes. What is that really about?
Yeah, actually pre-diabetes, as the name implies, is a state which is between the blood sugar level of a particular person is between the normal and the established diabetes. So as the name implies, a person who's having pre-diabetes is more prone to get diabetes at a later stage. So
as well as they are having the macros.
yeah, the importance of the term pre-diabetes is they are at risk of developing certain complications as in diabetes. Now, for instance, they are prone to get more heart attacks, stroke, the limb problems. So it's important to address the issue of pre-diabetes similar to diabetes because they are similarly at risk of developing complications.
Because when we talk about prevention of diabetes, so if we can identify the pre-diabetic population early in their illness, we might be able to retard the progression to diabetes, or we might be able to stop developing diabetes on them at all.
I see.
So that is the importance, because the people are more motivated when we say that they are having pre-diabetes rather than when we are saying that they are healthy.
Okay.
So they will be more cautious.
I see. I think on that note, we at GMSL, we have a slide on pre-diabetes, but we will get there. We'll be discussing a little bit more about it soon after we go in for a short commercial break. So don't go away. When we do come back, we're going to talk a lot more about diabetes. There's a lot to learn this morning, and we're sure this is a topic which you needed to research about. So don't go away. We'll be right back here on Good Morning Sri Lanka.